Two of the most respected hospitals in Australia are in the spotlight at the latest public hearing of the Royal Commission into Child Sexual Abuse.
Sydney's Royal North Shore Hospital and Melbourne's Royal Children's Hospital are among the healthcare institutions that are being investigated as the hearing concentrates on the conduct of a single doctor who was jailed for abusing patients.
We've heard a lengthy opening address from Hayley Bennett, the counsel assisting the Royal Commission. She's outlined three major parts to this inquiry that began today. One involves several victims who are not being identified, but who were children, all boys, back in the 1970s, and who claimed that they were abused by a certain GP at the time, Dr. John Rolleston. He was, in fact, also at one stage a senior director of medical services at the Royal North Shore Hospital. There was also mention of a case involving a man who was born in fact he was born in the 50s, but he was abused by a psychologist at that same hospital, or alleges that he was abused by a psychologist at that hospital in the 1960s, and also a woman who claims that she'd been abused at the Royal Children's Hospital in Melbourne in the 1980s by a volunteer. Now, all of these cases, we're going to hear from many of the victims involved. They've outlined their frustrations at reporting what happened to them. In the first instances, many of them tried to complain to the Healthcare Complaints Commission or the Medical Board. In fact, one of the victims has taken the stand. He goes by the code name AWA, and he has talked of his frustration over many years of trying to report the abuse that he suffered to the authorities, and how, in fact, his complaint was initially ignored or dismissed. In fact, he says that he was threatened by the Medical Board at one stage unless he dropped the case. And this was Hayley Bennett, as I said, the counsel assisting the Commission when she spoke this morning.
The public hearing will hear of the experience of a number of patients about the abuse and the reporting the allegations to the various institutions. The experience of these patients relates to care received across a broad range of healthcare contexts.
We will hear from a lot of other bodies, including police, including CEOs of those bodies, the Healthcare Complaints Commission, the various hospitals and government departments. So there'll be a lot of witnesses between now and Friday week.